Are you wondering if studying in a medical school in New Zealand is the right decision for you? Hey, in this video I'm going to give you a complete guide to the process from the start to the finish and everything you need to know about New Zealand medical schools. Hello everyone, my name is Eunice and I'm a junior doctor working in Christchurch Hospital in New Zealand. If you're watching this, chances are you're thinking pretty hard about studying medicine, but there's just not enough insiders information out there about what it's really like to study in a New Zealand medical school. Look, becoming a doctor is prestigious and cool and all, but man, it is a commitment. I wish someone gave me a rundown on how freaking long med school was and what to expect. It is a pretty big decision to make when you're 18 and just finished high school, so I really hope that this video will help you make that decision. I'll go through what med school is like in New Zealand, the pros and cons of the two medical schools that we've got, and how to get into med school. So let's get started. There are a couple of ways to get into medical school in New Zealand. There are three ways in general. The first one is the conventional way. You finish high school, you get into med school, and then the second way is finishing a degree and then deciding to do med. The third and the last way is the other category, where you're already working and you decide you want to pursue medicine instead as a career. But in this video, I'll just focus on the conventional way. Which is when you finish your last year of high school, you apply for a pre-med course. And there are only two universities that offer this in New Zealand, one in Auckland and one in Otago. I'm not gonna lie, this is probably gonna be the biggest year of your life thus far. It's a very, very competitive year. There's lots of new material to study for. Besides lots of lectures, there's also labs, tutorials, pre-readings, assignments, and of course lots of random exams to prepare for. So quite a few things to juggle on your plate. And while you're doing this, you're also learning how to time manage, deal with stress, whilst trying to enjoy uni life and try to be the top of your crop while you're at it. Not easy. Great, so you've done well in pre-med and finally you get into medical school. There is 5 more years to go. The first 2 years is called the preclinical year. It consists mostly of lectures, tutorials and labs with big exams at the end of each year. And you get taught a lot of content. Anatomy, physiology, pharmacology, biochemistry, yada yada yada, and so on. I remember one of our first anatomy lecture, she told us that she's condensed 10 anatomy lectures that she usually gives to the physio class into one lecture for us. So go figure. And after the preclinical years, you spend the last 3 years in the hospital rotating through different specialties. Most of the learning is based on the ward, from your team and from you taking initiative to do things on the ward to see patients. You're allocated to an actual team of doctors who will look after you the entire time that you're on your rotation, and the way that you're graded is actually through a clinical exam rather than written exams, which we call OSCEs, which are 7-minute mini stations where you complete a history exam or educate a patient. In your last year of medical school, you then become a trainee intern. Basically means you're a mini doctor, but you don't have the responsibility of being one. You're usually with your team 24/7, including the on-call days, and you learn to become a doctor while being closely supervised. And you're actually also paid for this role, which is kind of nice. In New Zealand, we also offer an elective program where medical students in their last year can do an elective for 3 months anywhere in the world. But recently, because of COVID and politics, this got cancelled. I'm hoping they would restart this again, but I don't know, watch this space. So when you've passed your TR year, you officially become a doctor. I've got this table here to illustrate the differences between Otago versus Auckland Medical School. So we're looking at pre-med, what the differences are, getting in and doing pre-clinical years, your second and third year, and your clinical years, which is your fourth and sixth year. So, in Auckland, you do biomedical science, which is the equivalent to health sciences first year in Otago Medical School. From what I gather, these two are pretty much the same thing, except that Auckland, they grade their year by just 4 core papers. So they take the 4 best papers of your year, compile the grades, and that's pretty cool because I guess if you do really well in your first semester with your 4 papers, you're sorted. But if you don't, then your second semester is going to be pretty stressful. In Otago, they grade them by 7 core papers, which means, I guess academically, Otago is a bit more stressful because you need to make sure all your 7 papers are, up to scratch versus 4 papers. Okay, and in terms of getting into the 2 medical schools, I'd say the main difference really is Auckland's interview. This is one that Otago doesn't do, which I sort of disagree with, and Auckland also does UCAT as well. These two combined holds more weight than the exam grades, is what I have heard, which is quite different from how Otago does things, but I guess with the interview itself, it's one where you are examined on how you deal with social situations. They're not really medical questions. I sort of just want to gauge what sort of person you will be when you become a doctor, which I think is pretty cool, and I wish Otago would do that too. But Otago grades sort of in terms of getting in as a 2-to-1 ratio, where 2 is based on your grades purely and 1 is based on your UCAT results. So it's very academic and there's no way to gauge how you are as a person through an interview, which I think is actually a disadvantage to quite a lot of people. And so there are rumours about whether Otago is easier to get in versus Auckland, but look, I don't think there is one that's easier than the other to get in. Both are pretty good. And now we talk about the preclinical year. And these two years are basically years that prep you before going into the hospital. So there's a lot of content, and they're pretty much the same except for how they assess you in class. So in Auckland, they assess you in terms of timing. They do it pretty frequently throughout the year after each rotation or after each subject. They call it sort of end of run exams. And whereas Otago, they just examine you as a big exam at the very end of the year, which is a bit harder to study for, I'd say. I'd much prefer having frequent exams and retaining the information rather than studying so hard at the end of the year. But yeah, and in terms of the clinical year in your 4th to 6th year, again, it's basically not really that much different, except Auckland, you can practice in North Island hospitals, and Otago, geographically, you stay in the South Island, or you can actually go to Wellington as well in the North Island. But Christchurch and Dunedin as well are very good teaching hospitals. And really, everyone sort of completes their medical degree, and they are hired through ACE, which is the universal system that the whole country hires their doctors, and you become an RMO, which stands for a junior doctor. How do you prepare for medical school? So if you're in high school, I can give you a few very useful tips that I wish I knew before I went into medicine. Number one, ensure that you're taking all the right papers in high school. Do the 3 sciences, do stats, not calculus. This sets you up pretty well if you've done these before, or else it'll be a pretty steep learning curve in uni, and you really don't want to start on a bad footing because you can't afford it. And if it's too late for you to change your subjects, that's okay. You can always do summer school papers to catch up on these. So visit the uni websites to find out more on when they're doing that. Number 2, start doing UCAT papers in high school. You can even try sit the UCAT exam to see what it's like. Some people think it's a bit of an overkill, but nah, I kid you not. UCAT is all about practice, 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 and performing really well under time pressure. And there are plenty of free resources out there and practice papers if you're keen to try. Number 3, if you're in high school and you still don't know how to study efficiently, I suggest you better find out a system that works for you before going into uni, or else you're going to feel like you're constantly behind and be really stressed because of that. Look, there's a lot more advice I really want to give you about getting to med school, but I'll do that in a different video. I hope that you found that useful as a wee little snippet into what studying medicine is like in New Zealand. But if you want to find out more about specific tips of getting into med school in New Zealand, stay tuned because I'll be posting a separate video about this soon. Take care. Thanks for watching, guys.